Good morning. Thank you for being here today. I'm Dolly Maiti, a biomedical engineer applying for medical school with a passion for bridging the gap between technology and healthcare. Who here is a parent or a grandparent or the fun uncle and aunt? Babies often bring a sense of joy and light into families. A few years ago, I had the opportunity to travel and work in the healthcare system in India, and very quickly realized that the L&D department oftentimes meant one room with one bed and a doctor miles away. Even as all of us in this room are invested in making human life a little bit better, as a developed country, we overlook our privilege of access to healthcare. I have firsthand witnessed maternal fatalities caused due to socioeconomic and geographic barriers getting in the way of basic preventable care. That is why I'm here to share with you a novel solution for early diagnosis of deep vein thrombosis using biochemical changes to prevent pulmonary embolisms and potential strokes. With the intersection of cardiovascular disease on the rise and the hypercoagulable state caused by pregnancy leading to deep vein thrombosis and eventual pulmonary embolism, it's one of the leading causes of maternal mortality. Thus, it is imperative to mitigate the rising phenomenon and improve the overall survival, not only for expecting mothers, but their infants as well. The newly proposed method would involve using infrared radiation to pick up on the presence of a clot. Oxyhemoglobin and deoxyhemoglobin interact with infrared light differently. IR light gets absorbed by oxygenated blood, while deoxygenated gets transmitted. When infrared light is transmitted onto a vein, it gets absorbed by the oxygenated hemoglobin and gives an absorbance ratio of output to input close to 1. The NIR device will be able to provide relative measurements of oxygenation levels of calf veins and can help identify areas of excessive deoxygenation caused due to blood clots through the body's own biochemical changes. The current non-invasive diagnostic methods include D-dimer tests and various ultrasound methods. These technologies used for diagnosis suffer from reduced detection accuracy with increased depth, false negatives when parallel veins are present, and inaccuracies of imaging due to factors such as edemas or obesity. The invasive method includes a range of contrast phenography, which requires the administration of an iodine-containing contrast dye, unideal for pregnancy. The validation of this technology would reduce the need for these big, expensive machineries, highly trained personnel for result interpretation, and most importantly, increase the comfort factor for healthcare staff and patients. Future steps in the validation of this device would be to gather large samples of data for standardization of readings and spectra. Once IR is validated as a reliable technology for deep vein thrombosis detection, development of a robust hardware would be essential, one which grants portability, easy probe functionality, and a spectra display right on the device. In the future, IR can be further explored as a diagnostic method for other cardiac conditions. With the device still in its early stages of testing, its potential is endless. As gestation progresses, a higher rate of DVT and pulmonary embolisms have been documented. Early diagnosis would be a game changer in future medical decisions. By far, the greatest advantage of this technology is being able to obtain standardized readings based on a simple scan without the need of a highly trained personnel and further subjective interpretations. With telemedicine on the rise, a device of this nature would allow reduced testing time to divert resources for where they're most required while mitigating costs. This type of portability and affordable accessibility is exactly what we need to reach the communities most in need of healthcare. This technology would not only allow us to target one of the most susceptible populations, but eventually anyone at risk of deep vein thrombosis. Thank you for your time and attention.